Skin cancer is when the skin is damaged by the sun's UV rays, or the DNA in the skin is damaged, and the damaged skin accumulates or grows and turns into a cancer. Melanoma can affect any sort of skin tone. It can be African Americans, Latinos, Asians, anyone. But I think sometimes it can affect African Americans more disproportionately in terms of fatality, because we may present at a more advanced stage, just because we may not be as aware that skin cancer can affect us or our skin tone. I would caution any sort of patient to look out for what we call the ABCDEs of melanoma. And us as dermatologists, we look at this as well. So A being asymmetry, if the lesion is asymmetric, of course. The border, if the borders are jagged or irregular, you'd want to pay attention to that. And then the color, is there color variation? Is one side darker or lighter compared to another? And then D, diameter, so is it over 6 millimeters or the size of a pencil eraser? And then E, is it evolving, a lesion that's been changing over time, or maybe it's grown more quickly? So things that are more darkly colored tend to be melanomas. Definitely use sunscreen, and I would recommend sunscreen that's broad spectrum, so it prevents against UVA and UVB rays, one that's water resistant, and reapplying sunscreen every 2 hours, particularly if you're outdoors, and SPF 30 or above is recommended. Some people may ask, oh, well, which sunscreen do you recommend? And we tend to say whatever sunscreen you will use. For instance, if you have a darker skin tone and you're worried about the white sort of residue that it may leave behind, or if you're just worried about that in general, then you can look for the more sheer sort of sunscreens, or maybe even the tinted ones. Even if it's cloudy or overcast, go ahead and put on that sunscreen.